Thank you for being with us, sir. Again, Dr. Ramprasad Gopalan, an infectious disease specialist. Introduce yourself. Where do you work? Tell us a little bit about yourself really quickly before we jump into the questions that I know a lot of people have.
Okay. Hi, my name is Ramprasad Gopalan. I'm an infectious disease physician. We work in many of the area hospitals. We're working all the way from Bethesda to JFK North, JFK Main.
Dr. Gopalan, let's jump right into it. The Johnson & Johnson vaccine, about 6.8 million doses have been administered in the U.S. thus far. Regrettably, sadly, 6 people, reports of blood clots in 6 cases, ages 18 to 48. I think we have a graphic we can put up. Obviously, the blood clot, a concern. At least one of the cases, someone passed away. But we need to put perspective here. As you look, all 6 cases among women between the ages of 18 and 48, symptoms occurred 16 to 13 days after vaccination. That a joint CDC and FDA statement. Put this in perspective for us, doctor.
Okay. As with any vaccination, you got to take the protective phenomena of any agent along with the negative impact. What happens in a trial, a drug trial, we do thousands of people get involved in a drug trial. But what we call a post-marketing phase, that means when we start administering a drug, especially this is something called EUA, that means we are fast tracking most of the drug because it is based on the good for the society. So with that, we have to anticipate some of these things because now from thousands, you are going into millions.
Doctor, I want to boil it down. Tina Tobeck Keller puts it very well. The bottom line is it's regrettable when you have any cases, but nearly 7 million doses. The bottom line, should most people still feel very comfortable about the Johnson & Johnson shot? Tina Tobeck Keller said, I had my J&J shot a month ago. Any reason to worry? It's easy to look at these, and I have a loved one who had the J&J shot as well. But in the totality of it, nearly 7 million shots, 6 cases. Let's begin there. At the bottom line, in your estimation, is this a safe shot? And should people be in any way, shape, or form unduly concerned in general?
Okay, now there is a concern about having a amount of clots which happen 6 out of, it's 1 in a million so far. It is a rare chance. That means, I don't want to say the chance of us getting hit by a bus or more, but because if it happens to that person, it is 100%. Now, having said that, now we have stopped, administering this vaccination until we can delineate what is the actual etiology and what is happening. There are a couple of things what has been proposed, but to say, is it safe? Well, in the vaccine world, yes, but right now we are cautious. We are learning why this is happening. And then till we can delineate 1, 2, 3, 4, reasons, I think it is best just to make sure that no other things what we can prevent. There may be a manufacturing process, maybe something different. If it is due to one of those where we can prevent anything happening, then we need to do that. But
well, doctor, we also don't know if it could be sadly underlying health conditions with the people involved that have nothing to do with the manufacturing process. So we don't have those answers yet.
No, we don't have any answers. That's why we actually are stopping the process, and I commend FDA and CDC for doing so.
Dr. Pamela Conway says, my daughter got the J&J shot, just had a sore arm. My son-in-law had the shot, and he's sick as he's ever been in bed. Should I be concerned about him? Try and frame this for people at home who are not doctors, but just, and understandably, there are concerns, but try and frame that and assuage the concerns vis-a-vis number of people who've gotten the shot, just in very basic layman terms. What do you say to people said, I'm a little scared, I got one. Should I be scared? Should I be worried? Just give us your best bedside manner advice.
Okay. Well, scared, no. Concern, yes. You need to watch out for symptoms like headache, unusual body ache, soreness, but here is the problem. I did get the vaccine, but not J&J, but I did get Moderna. All these vaccines do have local reaction or what the body is mounting an immune response. So we do have sore arm. These are the things you anticipate in each and every one of them. So it is not particular to one. But if you start having unusual headache, leg pain, so far it is within the first 3 weeks after you received the shots. If you have any of those symptoms, I think you need to check with your healthcare provider and go to make sure if symptoms are overwhelming, you need to go to the ER. And because the treatment is a little different for this kind of clot than the regular clots, how we treat.
Elena Skiba says, I had my J&J shot 2 weeks ago. I'm 59 years old, only had side effects, chills, low fever, muscle ache, sore arm, nausea for less than 24 hours. I feel fine. I've been back to normal since then. For the overwhelming majority of people who've gotten this vaccine, they've either had little reaction or something along the lines of Alini. Is that a fair statement at this point?
Yes, that is a very fair statement because now you look at the 6+ million people to 6, it's technically 1 in a million. The odds are like that at this point of time. And majority of them who do receive shot do get symptoms like what Eleni got, and that is expected reaction. What is not expected is clots and things of that nature. But what you look for is unusual thing. Then if these symptoms are usual, but anything unusual, then you got to worry about it. And if it is persistent, at that point, you need to get to a healthcare provider and take necessary precautions.
And that's with anything that you take medicine-wise. Is it? Let's go to a few more questions. Well, one person says we're talking about J&J. First of all, there is a temporary pause while they investigate these reports. At least according to a CDC and FDA joint conference today, they hope that it would be a relatively brief pause while they get to the bottom of this, and that they can then put J&J back into arms. Of course, in Florida, a lot of you writing in have gotten J&J, but now people, in addition to asking about the J&J single dose, some people inevitably are asking about others. One woman asked, let me go back to the question she asked. She was waiting for her second Moderna shot. So people hear about J&J, they're concerned. They said, I've had my first Moderna shot. Should I get my other? Again, we need you to frame this from a public health perspective. And though it is very sad when anybody becomes ill from this, I would seem to me as a layperson that right now we have a very, very, very statistically small sample here of the most egregious problems, and that we all need to take a deep breath. Is that fair?
Correct. But here, to specifically answer Ms. Yolanda's question, yes, you should take the vaccination because what is proposed for J&J's vaccine is possibly the vector. Okay, in simple terms, you deliver the medicine using a vehicle into the body. How that piece of that little viral particle, how we can get into the body, that's what is different between Moderna, Pfizer BioNTech, and what we have in J&J. What we're using here is a viral vector. So is the AstraZeneca, which is not here, but it is halted in certain countries based on similar issues with clots. So what they're surmising out of this one is possibly the vector what we are using, that is the adenovirus vector, how you deliver the medicine to the body, may have something to play in the immune reaction of certain people. And again, this is very rare. And if you look at the numbers, it is 6 million doses plus to 6 people having that. Yes, we should be concerned, but not scared. The other vaccines have had no such effects, and especially the ones which are approved here, like Pfizer, BioNTech, or Moderna. If you gotten the first dose, please do go ahead and get your second dose and be protected. Don't delay because this is different.
Now we have from Franklin Benson, and I don't know that you have the answer, and then I'd like to put up a woman who asked about taking aspirin. Would that help? Franklin Benson asked, what percentage of the population, Dr. Gopalan, again, infectious disease expert, kind enough to take time to join us at the end of a busy day, and we thank the doctor for being with us if you're just joining us. He says, what percentage of the population who didn't have the J&J get this rare clot issue? I don't know that you have those kind of numbers.
Yeah, there's no a specific percentage of this. It is in my experience. We've seen very handful of them in decades of practice. It is very rare. This kind of clot is pretty rare, and it is immune mediated reaction. So it is a little different than what we normally see in other forms of clots. Yes, it is rare without the vaccine, and it's also pretty rare even with the vaccine.
And to that point, Donna Notofranco says, what are the stats with all three of the drugs, such as had we had any problems with the other two vaccines? That from Donna Notofranco. And that kind of leads out of what you were just talking about.
Correct. I mean, the current issue with the clot is only observed in the Johnson and Johnson and AstraZeneca, and the other two, which is approved in United States, Pfizer, BioNTech, or Moderna, does not have such issues documented.
Sir, let's tackle this head on, because a lot of people, Roberta Wilson sums up the concern. I've heard it from people. They're just worried about all the shots. And Roberta Wilson says it's the shot that caused this dilemma. These shots are no good for you. Check the so-called vaccine sites. What do you say to people who still have a lot of skepticism about the safety and efficacy of these shots in general, both J&J and to some extent also any of the shots? What do you say, Roberta Wilson making that comment? Maybe we can put that up. What do you say to that skepticism and concern?
Yes, for vaccine hesitancy, what we call, the real disease is still real. I have seen thousands of these diseases, and it is not just a disease of the old person. I've seen 29-year-old who didn't make it in spite of the best efforts and best care. And also I've had 100-year-old who did well and we got them home. Okay, now we are in a pandemic of unknown proportion. The world never saw the like of this before, like this. We are in a era where modern travel, modern transportation, you can propagate a pandemic pretty quick before we can put a halt to it. Now, these vaccines have already proven to to halt the disease, or to not have a really serious disease when you do counter this. With that, I rather be protected. Yes, everything, including the air we breathe, has issues. Yes, there is nothing 100% everything positive, but we have tested and things have gone through with millions and millions of doses, and issues have to weigh in the plus while against the minus. As with anything in the world, as with any intervention we do, we have to ask ourselves, is the plus outweigh the minus? If the answer is yes, we got to go for this. And this is one of them where the plus do outweigh the minus, because the chance of real disease is pretty real. And if you cannot tell who is the population or who are the persons who can get the severe disease.
Doctor, to sum up, bottom line for you, do you still believe everybody, notwithstanding trying to check the genesis of what may have caused these clots for these 6 people out of these millions of doses given so far? We don't know if we'll hear about more cases or when, but for now they're studying that. For now they're on a pause with J&J. The bottom line, plain and simple, do you believe people should still overwhelmingly heed the advice, and do you give the advice, get the vaccine?
Yes, you
absolutely,
should get the
no doubt
vaccine.
about it.
I have no doubt in my mind. I did get it, and I'm even suggesting my 18-year-old will also get the vaccination before she goes to school. And once the population is opened up for the rest and then we have it, I would have everybody vaccinated. Yes, I have no doubt in my mind.
Okay.
Again,
now,
yes.
And I'm going to talk, Scott, hold on as I can kind of go through these questions, because some of the questions we're putting up and I'm not getting a chance to have him answer them. One person said, no vaccines for me. I'm speaking to Scott, our great producer who's making all of this happen for us, does such a great job for us. One said, no vaccines for me. You would say to them?
Okay, well, here is the thing. Well, I understand, but first thing is I'll ask him, what is scary? Is he or she concerned about all these things, what is in the media, adverse impact of the vaccination. But again, you got to know the number of people who have taken the vaccine to the number of people who have had issues. Now, put that in perspective of real disease and how many people you know have had the disease and who have A, succumbed to the disease, and B, yeah, got better, and C, who are in the post-COVID phase. And I have plenty of people who are suffering months and months after they have recovered from the disease. These are young athletes, these are healthy, well able-bodied people, and they are having issues. So would you rather have those, or the vaccination, which does protect against these things? Yes, I understand the implications that you can have adverse impact of any vaccination, but you are weighing the risk benefit, again, risk of having the real disease and those symptoms. If you there is no reason around, people say I'm young, healthy, and I'll be okay. No, that is not the case, because we are still not at the point to say you will not have any adverse impact, you will have an adverse impact from this. So the science is not there yet. So unfortunately, till we get there and we know what triggers in our body which makes it worse, or how we respond to the disease, vaccination is the best.
Respond directly to this question from Claretta Pickett. Every day, something new discovered about these vaccines. Then you wonder why the younger generation is afraid to get it. I had the J&J almost a month ago. As a healthcare worker, should I be worried?
No, I mean, up until this point, it is 3 weeks post vaccination. You're fine. That is what we have in this, studies and discovered. So after 3 weeks, there is no issue so far. So I think, as of the science of today, you should be fine.
Let's see. As we continue, there continues to be, and understandably so, a lot of people, a number of questions, and let me see if I can. A number of questions speak to the fact, this vaccine was developed, these vaccines developed so quickly. The bottom line is there's a sizable segment of people who legitimately feel that, quote, rushed to get these vaccines ready. And they're scared that we just don't yet know the long-term impacts. And this is the kind of thing with Johnson & Johnson, despite all of the perspective you're putting around it, that again engenders, and a lot of people say it should, a lot say it shouldn't, but there's a debate. It engenders the debate about, are we going too fast? Do we know everything we need to know? And answer that, because I'm seeing it left and right in some of the questions here.
Right. I mean, both sides are valid point. Is it rushed? Well, you have to, in a pandemic, to curtail what is happening in the world. You see things, what we thought we contain in a lot of countries are going back to restrictive measures. They are in Europe, in Asia, where we thought things were doing okay, but they are at a higher plateau, where they achieved not a normal low plateau, they achieved something called a high normal plateau, like a higher. So things were okay because they were following certain restrictions. When they let go, it went up. So now for the people who say, hey, this is too quick, no, this is what we need to halt. Yes, is everything studied? We do study the efficacy, safety of these things. But as I said, in a trial, we have tens of thousands. When it comes out to the world, we are using millions. Of course, we do see something, which we didn't see in the study. This is not true just to the vaccine. It is true even to any medicine we do.
Dr. Melanie Barron-Gast asked, I received J&J on Sunday. Should I worry for the next month? She says, can I help myself by taking baby aspirin? Again, Melanie Barron-Gast. Got it.
No, this,
you can pop it up. Let me finish. Should I request, there's the question. I received J&J Sunday. Should I worry for the next month? Can I help myself by taking baby aspirin? Should I request a certain kind of test from a doctor?
D-dimer test. Well, now, if in the next 3 weeks, if you develop any symptoms, severe headache, muscle cramps, or anything which is not the usual local reaction. Yes, you can ask your doctor to check. This is a different kind of clot. This is a platelet antibody. Again, we can figure it out at that point because we have a cause and an effect. Right now, no, that is not is the recommendation. Either a baby aspirin or doing a D-dimer test is not the recommendation. So watch out for the next 3 weeks from the time you received your vaccine. If any of those symptoms which you develop, like unusual cramps, leg cramp, headache, unusual headache, which is not going away, please do contact your healthcare provider at that point.
Again, Erica Moore says, we know how to handle COVID. We don't know how to handle the vaccine reactions. That's from Erica Moore. Trying to get to as many of your questions as I can. They kind of zoom by here. So I'm trying to get questions that are reflective of other questions that are sort of in the same category. Speak to that, doctors.
Yes.
Well, we know how to handle COVID. We don't know how to handle the vaccine reaction. Your response
So
to that?
we are handling the COVID, but again, the problem with handling the COVID is how we are getting affected by it. Again, that is the problem. People, we have treatment, we have plan, but who is really getting severe effect of this COVID? Yes, you really want to, get to the disease phase of this illness, or you want to protect people from the disease. Yes, you do see some of the adverse reactions from the vaccination, but again, most of them are anticipated reaction, and then we can have we can affect, we can technically take care of those too. How each one has a different modality of approach, but we rather not get the disease, and the vaccine reactions what you're seeing is very minuscule portion, but the disease is in hundreds of thousands. So disease versus vaccine reaction, if you compare, there no comparison between those two. But again, the way we also know how to handle some of these as things progress, we will get to the bottom of this and why what. So this is the reason.
I see a batch of comments that either say hysteria, as in you're going to create hysteria by focusing on 6 cases out of 7 million shots. Then you have the other extreme that says nobody should take the vaccine. Calm us all down and tell us where, from your doctor perspective. Of course, everybody at home has vigorous opinions as well. You should. That's certainly all of our right to have that. But correct. Again, apply your best bedside manner to those who want to get the shots or be concerned, all the way to those who say, too fast, I don't want them, no good for us or society.
Okay. Now, the vaccine which has had reactions and adverse impact, which is in the news, are Johnson & Johnson and AstraZeneca, where the vector is an adenovirus.
And plain English, the vector in plain English is what?
Okay, what it means is how you deliver the medicine to the body so the body makes an antibody to the virus. Like, how do we put this on? We can't just mix it up and give it. It doesn't go. So how do we get this into the system so the body reacts to that is what we call a vector. So now Moderna and Pfizer-BioNTech uses something called a mRNA technology. It's a messenger RNA. We make a piece in the RNA, we deliver that using the message in the mRNA. We have not had any issues with those two. So right now, since we have halted Johnson & Johnson till lot things will be known about those, you can opt for these two, which is so far has not had any issues to counter like the issues with Johnson & Johnson. So we can put all of them at the same club because they are different technologies. Both of them use totally different technology to achieve the same effect. So
what do you think the likely outcome is going to be of this investigation into Johnson & Johnson's vaccine and this pause? And again, nearly 7 million doses already given, 6 cases of rare and severe brain blood clots. All were women ages 18 to 48. Symptoms appeared, doctor, as you well know, 6 to 13 days after vaccination. What do you think is the ultimate outcome likely? I know you don't have a crystal ball, but where do you think this will all go?
Correct. We would figure out why and how and who have developing this kind of reaction. So first of all, we'll figure out why is this happening and what is the exact reason behind this uh, issue of having clots from this vaccine. So once we figure that, then we can avoid certain population. If we know certain people are afflicted by this vaccine, they have certain predictions for, hey, we can predict, okay, this person will have a adverse impact. So we will figure out that. And number two, if it is really any manufacturing process or any additives or anything which is causing this, so then we can take that out and use a safer, different alternative to that. So by the time we will figure it out, the reasons for this, and then we will have a remedy. In the meanwhile, we do have other effective vaccinations which we can use in this country. So we have to proceed with those and go with the others till we figuring it out.
Marcel Griffith Burke says the numbers worldwide show the vaccinations are working. The long-term side effects of those who have had COVID are more troubling. Do you agree with that assessment?
I 100% agree with Marcel, because I have seen the term, what we use here is called long COVID. I've had lots and lots of patients who have these symptoms, all the way ranging from debilitating illness, including shortness of breath, unable to do what they were doing before, and progressive debilitation. Now, these are not 80, 90, 100-year-old. These are some of the young, productive 30s and 40s. So, having said that, those numbers I've seen more than the vaccine reactions, what is even reported in the whole vaccination series. So,
Christy Anderson says 3 of my friends and I all had severe kidney pain. I think she may mean from the shot. It says free the shot, but I suspect that may mean from. If all 4 of us had kidney pain, why is that not on a list of side effects? Any knowledge about that being a side effect?
that is not one of those. After I have seen treated people, thousands of them. I have not come across this particular complaint. But if it is, then we
Everyone.
have to work on it. I mean, not I'm not saying it may not be, but hey, so far we have not seen one of these. So, but if it is related, they will definitely work with that and then go forward.
I'm looking at other questions. Doctor, we've got about, why don't we, Scott, take it right up to 7 o'clock? Somebody was asking about studies on future neurologic effects, and Ashley Corrine Frick Marangione says they can't possibly study something that far in the future. No way to predict with new vaccines. I think she may have been referring to, and forgive me, Ashley, but I think you may have been referring to the question about being able to study for neurologic effects that another of our viewers, and thank you all so much at home for weighing in with your thoughts. We appreciate them. I simply cannot get to every one of them flying by, but speak to that in terms of different kinds of studies, to this comment, they can't study something that far in the future. Again, I think this may be a reference to another question about potential neurologic effects. Again, that's an ongoing concern. People say you can't know what you don't know yet.
Correct. But again, what we know about things are immediate safety and efficacy of certain things, including these vaccination. So now, in 1,000,000 doses, if we did not see a immediate clear present danger, yes, there are things what can happen down the lane. And now we are weighing, again, goes to the premise of risk benefit analysis in anything. The risk of COVID and having worst outcome and having post COVID after that, does it outweigh the risk of what we are talking about in certain individuals, like immune reactions and so on and so forth? Yeah, you can never see the future ever, but in this scenario, which is there is a clear present danger which is staring at our face, and how are we going to protect that? So that is vaccination, and that is how we reach the herd immunity, curtail it, and then we can look for the alternatives, what we can do to prevent this from happening.
Dr. Eileen Pogner, excuse me, Eileen, and my reading glasses aren't what they used to be, Eileen, I apologize. Doctor, why don't they address anything, Eileen asked, about people who medically cannot take the vaccine? Are we doomed to permanently be locked down? Those who, for medical reasons, can't take the vaccine? Interesting and good question.
Correct. But there are very few who are, in this category who cannot take. Hence, we are trying to reach a herd immunity for the rest of the population. So there comes a point when we vaccinate enough so people like Eileen can walk safely, because the transmissible people out there are very, very minuscule and negligible. So people who can and able to take, if they take precaution and then if they take vaccination, or if they reach the level of immunity, so people who really cannot take are protected too, in that sense of herd immunity.
Doctor, for those who have came to us and have stayed throughout, first of all, we thank you. We've segmented the questions between people who have concerns but got the shot. We did ask, would you get the J&J vaccine once the pause is lifted? What would your confidence level at home? What will it be once they work to ground the research on what happened here? Again, let's put up the numbers one more time, Scott. 6.8 million shots, closing in on 7 million Johnson & Johnson single vaccine doses given in the U.S. They're investigating 6 cases, if we can put that graphic back up for the doctor. All 6 cases occurred among women between the ages of 18 and 48. Symptoms occurred 6 to 13 days after vaccination. Again, for those 6 cases, extremely sad situation. And the totality of where we are, Doctor, for those who have joined us with their concerns, close where you began. What is your best advice, given what's happened here, about vaccines, getting vaccines, about what to watch for with the investigation on J&J, and your bottom line advice is somebody caregiving, but also taking care to address the raw feelings some people are having, understandably.
Correct. Now, yes, people, you have to weigh in the real disease risk versus the perceived adverse impact from the vaccine. So, what I mean by that, now, if you do get the disease, your chances of having severe issues with the disease are real. Whether you're young or old, I have seen all across the board, people do have risk and they have had bad outcomes. Now, yes, as with any vaccines, you've had adverse impacts. Now, people have put out these vaccines in good faith, and they have done due diligence in doing safety efficacy. Do we know everything about these? No, because as with other vaccines, it takes decades to develop these things by the time it comes out, because everything has been worked out. Do we have that kind of luxury and time? No. Why? Because this is a pandemic. We have to put a break so we can get on with our normal life. The only way where we can get this is to vaccinate people and have this disease stop in its track. Yes. Is it 100% safe? Nothing is 100% safe. And
just to interject, Anna Margarita says to that point, and I want you to pick up your thought. I got mine, J&J vaccine Friday. So far, so good. If she doesn't have any symptoms, don't panic. These are 6 people out of millions. Your take on her statement?
Correct. You're, Miss Anna, you're 100% correct in that there is 1 out of 1 million who have had this bad reaction. Yes. Now, there is another 6 million of them are protected, and they will be protected by this disease. Now, we have to take that from that sense. That means this population will be included in the pool of people in this country who would be vaccinated, so it won't, the disease can stop in its track. That is what we call reaching a herd immunity. All this are getting to the goal where we will be fine, and we have to be fine, and we cannot have fear, but we need to be concerned. Now we have halted J&J. Yes, we will know why, what, and then, but we still have 2 other effective alternatives. So start with them, but I think they have to ramp up the production to meet the demand of this country, and so is the world. and they will. And have no fear. But yes, concern, true. My bottom line advice is, well, this one is still 6 out of 6 million. And
Doctor, and to that point, I want two questions. One gentleman says this is not a vaccine, it's a chemical pathogen. Answer that concern from Gary Welch. And let's put that up. And then Diane Cook Casey, can you explain? I know you're going to need to break it down very simply, but I've had people say, I'm worried my DNA will be changed. I'm not saying Diana's asking that. She's just simply asking, can you explain how mRNA vaccines work? So let's first take Gary's concern. People worry we're putting something in our bodies we shouldn't. And you see Gary's comment. It's not a vaccine, it's a pathogen. Specifically answer Gary's critique, and then we'll go to Diana Cook Casey for simple, as simple as you can make it. How do these vaccines work in our body? What are they telling our body to do? First, to his critique. Take that on.
yes, Mr. Gary. Okay, here is how a vaccine works. How does a real disease, once we get a disease, the whole virus gets in our body and cause the disease. Now, body finally fights the whole, virus and make, its own antibodies for a part of that virus, so that when you encounter that again, so you already have the soldiers to fight that particular virus. So that's called immunity. Now, how do we achieve this without getting the disease proper? So now we got to figure out the portion of the virus which body looks and makes the vaccine. That means makes the antibody. So that is called spike protein.
I think we're moving beyond Gary's question. That's been up. Scott, let's put up Diane Cook Casey's question, and we'll leave that as our last question, as you're explaining how this vaccine works. Again, doctor, you're so well versed in this, but simply put, how do the vaccines work? What are they supposed to do? What are they telling our body to do? Very, very simply. Boil it down for this non-scientific reporter here.
Okay. The messenger RNA is the vehicle that carries the codes for the spike protein. That's a part of the virus, which is, if you see all the coronavirus and everything, you see those spikes, which is projecting all over the body of the virus. That's what we take. And that antibody against that will protect us from having the disease. So we figured out it may not be a body, it may not, but the spike protein portion of that, if we make antibody that attacks against it, so we will not get the disease. So there is a DNA message which is encoded into this messenger RNA, goes into the body, and then in the messenger RNA outside in the cytoplasm, again, it doesn't change your DNA, it is an RNA. So you make the protein, which is an antibody, for simply put, for the spike protein.
My understanding is, I read one study that you could liken it to your body already has all the ingredients to fight this. The vaccine is simply telling what recipe of the elements your body already has to put together to fight it. Is that a fair, simplistic view of it's just telling your body how to take its own tools to fight this off?
No, what it is giving you is a cookbook. But if you really want to know, how do you make a certain,
giving you the recipe.
Yes, it is. You have all the ingredient, but you cannot make the dish. So you're supplying the recipe. Say, here is this. So here it is, and you're supplying a prototype. Say, look, it is this. So the body looks at it and says, okay, we make antibody to the spike protein. If it's too simplistic, yes, that's what it is. So you have the ingredients to make the antibody in the body, but you make that with the message, what you send it into the cell.
Bottom line, doctor, we've got about a minute left. Your final thoughts on where we are with this pause, as the CDC and FDA say right now. They hope, they say that it'll be a brief pause as they do research on what is behind these 6 cases reported thus far of blood clots in women 18 to 48 years old. 6 cases, one, I believe, fatal. About 7 million doses administered in the U.S. A great many of you in our audience tonight have said you've had the J&J vaccine. It's been being distributed in the Palm Beaches and Treasure Coast and throughout the state. They're on a pause in Florida. What's your send away message to people about the J&J vaccine, specifically the research, and what thought can you give us that hopefully gives us a little bit calmer perspective tonight?
Correct. Have no fear, because the fact is, it is still as the saying goes, 1 in a million. So it is really 1 in a million. Now, with that, now if you've gotten the vaccine within the last 3 weeks, watch, look for unusual symptoms like severe headache, body aches with leg pains, things which are not usually associated with the vaccine reaction, which should not last that long. If you have any one of those, please do contact your healthcare provider. Having said that, still we have safer alternatives to the vaccine. If you have not received vaccine and you are trying to get the vaccination and you're trying to get J&J, please do switch over to the other safer alternatives and don't shy away from getting vaccinated.
But doctor, we need to be careful. We don't know yet that this isn't a safer alternative. I think we need to be a little careful there. That's why they're doing the research. This may well be.
We're talking about the Pfizer and BioNTech and the Moderna. What it is right now we don't have any adverse impact as what we have with J&J and with AstraZeneca. We don't have that kind of thing. As yes, what I'm trying to say is yes, the other vaccines which are in the armamentarium to curtail this pandemic is doing so far so good. I mean, I have received personally the Moderna vaccine, so far, and that is what I'm saying. Not till we know about J&J, which we can stop, but we others are available. Please do consider wear mask, and still, social distancing is still the hope. Wash hands, social distancing, and I'm seeing things which are open and people are packed in the bars. Listen, enjoy, but this is still not gone. Every one of us have full responsibility to stop this. And if the more we tend to let go, lose, the longer we're going to suffer from this. So vaccination, yes, we have the other two which are still there. Please do get vaccinated. Let's reach herd immunity quick so that people who cannot get, the very few who cannot do the take the vaccine, can get protected, and let's get back to our lives, and which we all love to do.
Absolutely. And Dr. Ramprasad Gopalan, infectious disease specialist, a familiar face over the past year with our audience. And we're getting comments from people saying, thank you, doctor. A great information, doctor. And I would like to extend my thanks and that of WPTV. We know it is a very, Carol says, thank you, doctor. We're getting a lot of those. Can't thank you enough. I know it's a very difficult topic. You're dealing with the medical facts. You're dealing with the understandable concerns, skepticism in some cases, the natural fear and concern. I too have a loved one as Johnson & Johnson vaccine. So I don't say this from an academic point of view. I get it. But thank you, doctor. Let's put the doctor up one more time. The star of this half hour. You've been wonderful and breaking it down for all of us lay people. I know it's not an easy thing. Can't thank you enough. And your best advice too. Listen, as always, don't play doctor, any of us. If you have concerns, always call your own doctor. Don't try and evaluate your own symptoms if you're feeling something's more off than it should be. And I love that you said that, doctor. Let's call your doctor and let them help you make good decisions.
Yes, that is. And thank you. Please wear your mask, stay safe, and social distancing is still the way to go. And use the other alternative vaccinations available. Let's reach the herd immunity. And, yes, concern is good. And, don't be, afraid. It is, yes, get all the information you need, make safe choices.
Doctor, on that somebody said, thankfully, Dr. G, you're becoming famous with our audience. I cannot thank you enough for your expertise, your time, your patience with all of us and our questions. And I know you want to thank our audience too, doctor. We so appreciate all of you who've written in. We've tried to group the questions so we got a flavor of all of them. Each and every one of you with your concerns that you have. Thank you for allowing the doctor to speak to them, because every one of you had a question. Doctor can speak to this. I'm sure there are many more at home who had similar ones. So, doctor, thank you. And most of all, thank you and our Facebook audience for joining us this night. To all of you, be safe and be well. And we will conclude our broadcast now. Good evening to all. Thanks again, doctor.
Thank you.